Well, more children in Ontario are being hospitalized with COVID-19, and one pediatrician is noticing an alarming trend.
Dr. Dina Kulik says she is seeing COVID present like hand, foot, mouth disease in children and parents, and she joins us live now with more on this. Dr. Kulik, thanks for joining us to talk about this. You say that you're seeing this trend among you and your colleagues more and more. Why is this so important in terms of trying to contain the spread of the virus?
Yes, thanks for having me. I have been noticing this trend for a few weeks. Certainly, every year, a few times a year, we do see a rise in certain viruses that cause pimples or other rashes and fever. We often call that hand, foot, and mouth disease, where kids will get lesions on the hands, the soles of the feet, sometimes around the groin area, around the mouth or in the mouth, but it could be anywhere on the body. But I've been finding recently, the last few weeks, that a lot of these kids or family members also have confirmed diagnoses of COVID-19. And so recently I've been asking my families, the kids that have hand, foot, and mouth, or their parents, to swab also for COVID. A lot of them weren't swabbing because they thought they had this other diagnosis. I can't possibly have COVID and this other virus. But it turns out, at least in my patients, that all of them actually have confirmed COVID. The challenge is, if these kids are going back to daycare thinking they have this other diagnosis, they may not be isolating for the full amount of time that we want them to if it's also COVID.
That's interesting, Dr. Kulik. So is there a commonality between hand, foot, and mouth and COVID? Like, do they have similar traits in a sense?
They don't usually, so it's not on the list. Rash is not on the list of things that make us think about COVID-19. So I don't know if it's a different strain or there's a lot of, cross infections between the two. But in the last 48 hours, all of my patients that have had hand, foot, and mouth diagnoses have swabbed positive. So it seems too much to me to not be something that maybe actually is COVID. It's not actually this other virus, but rather is a manifestation of COVID.
Oh, that's very interesting. Dr. Kulik, is there an isolation period for people or kids with hand, foot, mouth disease? Because we know that for COVID right now, according to the province, is 5 days. So what is it for hand, foot, mouth disease?
It's really variable. Some kids are still contagious for 2-3 days, even some up to a week or longer. We usually recommend that as a child is getting new rash, new pimples, or until they're starting to scab over, they're still contagious. But a child may start to have, no new pimples and start to scab over within a day or two. But however, if they happen to also have COVID, or this is COVID, their presentation of COVID, I wouldn't want those kids going back to daycare or school or workplaces if you're an adult, if it actually is COVID and it was misdiagnosed.
Right. Now, Dr. Kulik, I'm curious, are you aware of the vaccination status of the children that you've seen, or are they under 5, or are they single or double vaccinated?
It's definitely a mixed bag. I've spoken to many, many parents as well that have this hand, foot, and mouth disease rash and COVID at the same time, or again, maybe it is COVID. A lot of these families, these parents are double, triple vax. The children that are more than 5, many of them are double vax. Of course, a lot of younger children getting it that are not yet vaccinated. It seems a mixed bag. I don't notice a trend towards unvaccinated or under-vaccinated presenting this way.
All right. And Dr. Kulik, are you concerned that because of these new symptoms arising in people with COVID, that this new hand, foot, mouth symptom or disguise might be indication that we're dealing with a new strain?
I do think it's possible, yeah. I mean, for me, it's I want to make sure that parents know that it could be COVID, and even if they have this other diagnosis, they should swab their child if their child has symptoms, if they're going to school or daycare, so we can make sure that they're isolating for the recommended amount of time for COVID. But also, hand, foot, and mouth disease is uncomfortable. Kids have pain, they don't want to eat well, they often have mouth lesions, and they're uncomfortable. So we want to make sure that those kids are kept comfortable, kept hydrated. So it is a good thing to touch base with your doctor if your child has any symptoms at all.
All right. Pediatrician Dr. Dina Kulik, thank you so much for chatting with us and bringing this to our attention.
Thanks, doctor.
You're welcome.